How can I protect my bone health?
Bone health is very complicated and very important in myeloma as well. You definitely should talk to your doctor about being on a bone strengthening agent. Along with that, we also generally encourage calcium and vitamin D supplementation, and you should talk to your doctor about how much of that you should take. It's sometimes not safe to do when people are first diagnosed and when their calcium levels are too high. And then, if at all possible, recommend things like exercise, trying to keep your muscle mass up, trying to keep active, because we know all of that improves bone health as well.
The number one thing a myeloma patient can do to protect their bone health is to keep their myeloma in control. That is 95% of what you can do. It is true that if your disease is out of control, using Zometa or Xgeva to decrease your risk of fracture is excellent, primarily for Xgeva and not as much for Zometa, but to ward off against hypocalcemia or low calcium in your blood. You can provide patients high-dose vitamin D, so-called ergocalciferol, 50,000 units weekly or twice weekly, along with calcium and vitamin D supplementation. Sometimes you can get symptomatic low calcium levels in your blood with Xgeva. You rarely see that with Zometa, but trying to ward against that before patients are exposed to Xgeva can sometimes make them feel a whole lot better. Lastly, there are some data to suggest that weight-bearing exercise and just exercise in general does improve some bone health, but let's face it, the number one thing is control of the myeloma.
We know that all bisphosphonates and we know that denosumab, Xgeva, decreases the calcium. We recommend that all patients should take vitamin D and calcium when they are on bisphosphonates, but it's absolutely necessary that you take calcium and vitamin D, especially calcium, when you're on Xgeva. This is so important because that the hypocalcemia, that means calcium is very low in your blood, can have life-threatening ranges if you're on Xgeva. So we really talk to our patients saying you have to make sure that you take your calcium in daily or or weekly according to what your doctor prescribed you because that can have life-threatening effects, especially when you're Xgeva.